Okay, I think we're going to start this session. So for all of you who are connecting either virtually or in person, welcome or welcome back to World Data Forum 2021. And thanks for participating in this session, session TA5.14, which is part of the forum's data governance stream of sessions. But in fact, this session is equally about the role of data in governance, as we will examine data's critical role in supporting government response to the COVID pandemic, what we learned from this experience, and what comes next. My name is Grant Cameron, and I'm the moderator for this session and the director of SDSN Trends, a global research network with a focus on connecting innovators across data domains to improve data production and use for sustainable development. And this session is co-organized by my institution and our colleagues at Open Data Watch. To set the stage, let's remind ourselves that from a policy and program perspective, the early phases of the pandemic were unprecedented and extraordinary. Real-time policymaking became the norm, and the scale of the social and economic support programs that were developed were massive and rolled out in a matter of days. Developing policy in real time required new forms of data to be rapidly created, joined in new ways, and quickly analyzed. As such, the value realized from data was immense, as data producers worked closely with policymakers as never before, and long-standing data silos were broken down. These innovations in data production and use helped governments demonstrate they could legitimately act to address the socio and economic impacts of COVID. But did this increase in government performance come at a cost of departing from social values? For example, citizens expect governments to consult, listen, engage on their policy and plans, in short, be open. And perhaps data ethics and privacy considerations were not always observed due to the pressures of data producers to respond quickly to policymaking needs. In this session, we'll hear from the experiences from 5 panelists on managing these trade-offs from national, continental, and international perspectives. So for those of you in the audience who have questions or comments or reactions, please put them in the chat box in the app that I'm sure you're now very familiar with in day 3.5 of the forum, and we'll try and address them through the session. If you're attending the forum in person and want to ask a question, you can either use the app or ask one of the folks in the session room for a microphone. Before turning to the panel, we begin with opening remarks that cover the development perspective from Catherine Vogel, Director of the GIZ's Data Innovation Lab. Catherine, the floor is yours.
Thank you so much, Grant. Thanks everybody for joining this exciting session. It's really an honor to kick this session off. Actually, the panelists are really impressive, and I'm really looking forward to listening to your discussion. So a couple words on the GIZ Data Lab and what we do with data for development and how we look at these things. For those of you who don't know GIZ, GIZ is an implementing organization. We are working on behalf of the German government mainly, but also on behalf of other governments or international organizations and implementing development projects worldwide. What is special about GIZ is that we have a very strong focus on and presence on the ground, and we have more than 20,000 people, employees working for us, and 70% of them are in country and are national personnel. And I have the pleasure to run the GIZ Data Lab. And this is a unit which really focuses on leveraging the full potential of new data sources for development. And why do we do this? Why did we create such a lab? Well, first of all, GIZ and the entire company and all our colleagues, they needed tangible examples of how data can actually influence and support our decision-making, our development projects, our evidence with which we work, and at the end of the day, our impact. So we need something where we can have a look at, where we can show how it looks like, but also we need to We need positive examples which reduce the anxiety, because people start getting scared of, like, what does it mean, work with data? What about the risks? Is there an AI coming around and doing my job, etc., etc.? So that's one thing. The other thing is that apart from developing new methodologies we can apply, it was about building up partnerships. And this is something I want to stress in my opening remarks. The GIZ has lots of partners, obviously, on the ground. We have direct access to our partners, the ministries, social society, civil society, the digital ecosystem, but we did not have access to data providers, to those who are at the forefront of developing new solutions, etc. So we built up a strong network, and then we tried to bring these worlds together, and then we realized that it got really tricky. It's really important to actually bring the supply side and the demand side of data together, but not only that, to bring them together with sector experts, with ground truthing experts, with local expertise, etc., etc. So we realized how important it is to really formulate clearly the ask of how data can be used for development projects, and then translate it, learn from each other, train ourselves, and really set up a platform in which we can jointly develop solutions for the development of our partner countries and in our projects. And so just to give you maybe one or two examples of how we do that, and this is a lot about COVID today, so maybe just pick one of those examples. Within the Data Lab, we started together with other partners an initiative called Data-Powered Positive Deviance, and there we tried to find those individuals or groups, or in the case of COVID, communities who outperform their peers in a specific context. So what we did is we looked at all the districts in Germany and tried to find those districts in Germany who outperform their peers with regards to controlling COVID-19. And what we did is we teamed up with researchers, but also with big data providers. We worked with mobile phone data, and then together with the districts, we analyzed, after grouping them in homologous groups, what makes a difference in controlling COVID with regards to the others. And there we found we had very nice outcomes and findings. And but it showed me again how important it is that there's an actor bringing these worlds together. And I know that SDSN Trans is one of these platforms and actors, and that's why I'm so happy to be here today and to listen into what your thoughts are on this, and how this excellent panel is actually working on using data from different data sources in order to inform policy. So looking forward very much to this exciting discussion, and thanks again for the possibility, and over back to you, Grant.
Great, and thanks a lot for those opening remarks. My sense is, without necessarily knowing what the group is going to talk about in depth, I think is this notion of the connectivity between data producers and users, and how that changed during COVID, and how sort of new forms of collaboration is likely to be a theme that worked well, or perhaps less well, might be a theme that runs through this particular session. So without further ado, we'll pivot now to our first national perspective. And I'm going to ask Anil Arora, Canada's chief statistician, to make some remarks in terms of the experience from Canada. Over to you.
Well, thank you very much, Grant, and thank you, Catherine, for really setting the stage. It's a pleasure to be speaking to you today from Ottawa, Canada, from the unceded territory of the Algonquin and the Anishinaabe people. Statistics Canada, like many other national statistical organization and international organizations, pivoted to, as you know, remote work practically overnight when the pandemic hit, and took on the role of simply being helpful and providing our expertise in data management to policymakers, businesses, other levels of government, academics, and researchers, as well as, of course, our citizens. And we took on the challenges of providing more detail, faster data and analysis, and far more insights on what was happening and what has been happening over the past, nearly 19, 20 months. We're leveraging our investments in cloud infrastructure, new analytic tools, dashboards, interfaces, geographical portrayals, and interactive tools. And the use of our outputs has doubled, tripled, and even in some cases quadrupled over both our traditional as well as our social media. And that is to me the greatest gratification, that people are in fact using hard facts and evidence and data that matter most during a time such as this. In our case, we led more and managed less, frankly, and moved from oversight to removing obstacles and freeing our talent to tackle pressing challenges. So the culture within the organization, I think, is a prerequisite to some of the successes that we've seen. We experimented, as Catherine just mentioned, using novel methods. So new data sources, crowdsourcing, took regular pulses of how various groups were doing, conducted probabilistic web-based panels, new rapid surveys and modules that we put onto our existing survey frames on going deeper into what was who was disproportionately feeling the effects of the pandemic, and really, really critical to policymakers, obviously. And each of our key socioeconomic surveys now provides far more disaggregation and much richer context for policymakers to really make informed choices and decisions. I'd say speed for us has taken on more importance than absolute precision, as we believe that getting out decent data when it's needed is far better than perfect data after the fact. So our flash estimates, for example, are now a regular feature in most of our economic outputs. Supporting our policymakers meant we had to develop new partnerships. Again, you talked about partnerships outside of government. Policy programs to help businesses and employees meant we had to better understand how different sectors and businesses have been doing, and working with chambers of commerce, for example, and associations. We developed business condition surveys, providing rapid insights on the quickly evolving situation, which allowed policymakers to quickly shift the extent and magnitude of support that was needed. Cities are using our data far more than ever before to better understand the impacts of their planning and even their tax bases, for example, and how things are changing. Academics used our virtual microdata access platforms, which are all cloud-based, to develop risk indicators for governments to target interventions. Our health modeling capacity helped develop data repositories that, again, help better understand personal protective equipment needs, and surveys supplemented which sectors were struggling to obtain sufficient supplies. We supplemented our interviewing capacity to help conduct contact tracing. We, of course, strictly limited face-to-face contact using scanning data for prices, telephone interviewing for household surveys, and even conducted the census of population and agriculture in a contactless manner with superb results. So data linkages, such as administrative tax information with our business register and our survey data, help better understand business viability, and population estimates and vulnerabilities due to existing health conditions helped our health officials target, communicate better, and roll out COVID vaccines. We've strengthened our measures to assure privacy through the use of proportionality and necessity frameworks, and through frameworks and governance to account for ethical considerations associated with the use of data sources. So Grant, you mentioned this right at the beginning. In my view, we can use novel data sources and strengthen privacy and trust that our citizens expect of us, even with greater transparency and stronger ethics than before. So it's been a privilege, honestly, to witness how committed and dedicated our colleagues have been during this crisis. And I mean that not only at Statistics Canada, but in so many national statistical organizations and international organizations the world over. It's been rewarding, and I would say at times overstimulating and even exhausting for some, but clearly there is little appetite to go back only to build on our successes going forward. And so I really look forward to going deeper into the lessons learned, both from a perspective of serving our policymakers and our society better, as well as the direction in which our respective organizations can be even more relevant and impactful. So thanks, Grant. Back to you.
Thanks, Anil. Maybe just one quick follow-up on your comment around, you know, sort of a little bit more of an emphasis on speed of getting information out over absolute precision. I guess that sort of presupposes that you have a better sense of what your customers need. So if you're getting something out fast and if it's not what they need and it's less precise, that's not a win for the organization. Did you step up your connectivity with users through the pandemic to ensure that what you were speedily producing was what they needed?
Well, and I don't mean to be flippant, Grant, but you know, if you didn't have strong relationships and well-built networks before the pandemic, chances were you weren't going to strengthen them during the pandemic, or it was going to be a lot of heavy lifting to do that. So I think, you know, we have well-established networks and really, really good relationships in many cases. We've been investing in that capacity of partnership and networking and really meeting our, you know, key policymakers on a regular basis. So we just put that mechanism that was there in a bit of hyperdrive. And, you know, we were asking them specifically what their needs were. And they weren't shy to tell us, you know, what it is that they wanted. And so I would say, you know, we leveraged those networks. And of course, we developed additional networks. And frankly, you know, where we weren't that strong, it took longer. It took longer to kind of get at, you know, accessing new data sources or, you know, building, you know, the sort of the framework underneath, you know, with MOUs and so on. And so that's one of the lessons learned is you have to keep those networks not just alive in theory, but in practice. And that just means you have to kind of work at it. And so a responsive agency is not an isolated agency. It's really an interconnected agency where that flow of information that tells you how the context and situation and needs are changing in real time is critical for us to be able to provide those outputs, you know, that are actually helpful and relevant in real time.
Great, thanks so much. Yeah, I think an important lesson learned. We're now going to move to Marianna. Marianna Vena is the Director General at Eurostat. And Marianna, I saw you kind of nodding in agreement with Anil when he was talking about how use seemed to go up of data products and services. You know, you were saying that in his case, some of the use doubled and tripled, and you were kind of nodding along. I guess from the Eurostat or the more your continental perspective on how the statistical systems evolved during the pandemic, can you shed some light from your perspectives, please?
Thank you very much. Hello to everybody from Luxembourg, from Eurostat, the Statistical Office of the European Union. And thank you very much. It's a pleasure for me to join the discussion and to provide, as you said, Grant, the European Union perspective and experience of our countries as well. So straightforward to the question, and it's easy to agree with Anil and all the other colleagues because we have experienced the same challenges, and we have found similar solutions, and we are exchanging best practices during the crisis. So straightforward to your question, what have worked well and what could have been better, or what are the lessons learned in the perspective of the future? From European perspective, like all my colleagues who are working with data and statistics, I could definitely say that the crisis has provided a range of opportunities for people working with data, because first there was a clear recognition about the need of high quality, reliable data, which of course produced almost real time and with more granularity. But also the whole period was fruitful and conducive, more fruitful and conducive than before to getting access to new data sources. And this, of course, is a good opportunity. The third element, the society, the media, the economies, the policymakers were very much welcoming the new experimental type of statistics. So I think Anil mentioned this, and Catherine as well. They were not focused on so much on accuracy, to the third digit after the comma, but they were welcoming more experimental work which could show trends and could be delivered faster. Now, I think it will be more interesting, and of course, I could speak a lot what we have done in Europe. No need to repeat what has been said by previous speakers. From new experimental indicators to track economic activity and scale of the crisis, to dedicated survey, to microdata linking, to accessing new data sources, special communication products, dashboards, etc. So I will concentrate in 5 minutes. I have selected 5 lessons which I would like to share and to bring to the attention of the panel and the audience. The first one, clearly the whole, let's say, as a title of these 5 points which I would like to share, is that the crisis has shown not only the importance of sources, techniques, and digital tools, but has shown the importance of having good data governance. To know what are the, by data governance, I include all activities, to know, to have rules, to have frameworks, to have clarity, how to get access to data, how to store them, how to process them, how to protect them. So this is the whole range of activities which are related to data governance. And if we have to concentrate on something in the future, if we are good as data producers in techniques, in calculations, in exchanging best practices, we have to concentrate on ensuring good data governance in the future in order to have the good sustainable, good results from the crisis sustainable. And 5 points in that data governance context. First one is the importance of getting access to data and to have rules for data sharing. With all the nuances of these issues, like for example, the crisis in the context of European Union has shown that the owners of the data would like to have very clear what we call frame access, to know what for the data will be used, what will be the purpose, how they will be processed, how they will be protected. A big question, practical question, was about granularity of the data. Do we need, for example, aggregated data from the mobile operators, or we need microdata? If we need microdata, do we need them to be anonymized or with identifiers? And these were key questions which we have to answer very quickly, starting from the purpose, but also going through technicalities, you know, like to have infrastructure to do the necessary processing. My second point is about in the crisis in Europe and the variety of experiences across the 27 member states has shown that what matters was the availability of basic data sources, basic infrastructure, interoperability, already existing experience in the public administrations to exchange data. So if this exists, the transition to adding new data sources and linking and doing it faster was quite easier than if this doesn't exist. And maybe this lesson is very important in the context of development policy and support, because in developing countries, for example, in our future efforts to support them, it's very important to put an emphasis to building the basic data sources on population register, enterprises, environment, land, etc. Rather than to have ad hoc solutions and going straight forward to the new data sources. The third point concerns the public trust. The lesson which we have learned, and I think Anil mentioned this as well, even if you have the perfect legal framework, you know that European Union is famous with legal frameworks. Even with the perfect legal framework, under the situation of COVID-19, even with the support of everybody to find solutions to overcome the pandemic, the question of public trust was at the forefront, was highly on the agenda, and people wanted to know what for the data should be used. They were very sensitive when the data were used for contact tracing, for example, or microdata were used. So accountability, transparency are very important if we want to have sustainable access to different data sources in the future. The fourth point is about the partnerships and collaboration, which I'm an official statistician. So in the community of official statisticians, actually crisis open opportunities, but open also many questions, because we have found partnerships in practice like data hubs, putting data together, working with ministries, with research organizations, but this opened the debate about our fundamental principles, because we know that, that official statisticians, they do not share non-anonymized data with the others. And when you have to do microdata linking, or you are working on cooperation with somebody else, you have to be very clear to the public and to the owners of the data what you are doing with this data. So then my final point is that what we have learned, and I will make this final fifth point consisting of, I make it twofold. In my list, I started from the point of view that we have to be proactive, because we have experience with data and with statistics. And when the society needs to come with the data or have to solve the issues of data governance, to solve some pandemic or any other issues, our experience is important. Our view is important, and we have to be proactive, talking to the governments, talking to the other partners, talking to the private sector, to offer them opportunities and to demonstrate them what we could do together for the public good. And my second point in this twofold approach about proactiveness is to be proactive with users. To come back to the point which Grant raised, it was crucial in this limited time with limited resources that we know exactly what is of the best priority in order to concentrate the limited resources on the products and services which could benefit most. The governments, the NGOs, the society as a whole in general. So I will stop with these 5 points. Happy to listen the opinion and experience of my colleagues who are sitting here, and also of the audience to continue this discussion. Thank you very much once again for your attention.
Thanks a lot, Marianna. That was really helpful, and addressing the questions explicitly on what are the dimensions of what worked well or not, I think is a really helpful frame, and one I think we have to start to perhaps codify a little bit more as a community in order to capture some of the lessons that Anil mentioned, and to sort of provide an easy framework for perhaps dialogue and expanding these lessons and applying them in other countries. So I'm now going to pivot to two more national perspectives. First, we're going to turn to Mark Soden, who's the Chief Statistician and Chief Data Steward for New Zealand. And then after he's made some remarks, we're going to hear from Tom Moultrie, who's bringing more of an academic perspective from South Africa. So let's start with Mark. Over to you, please.
Tēnā koutou katoa, and welcome. Thank you very much for the invitation, and greetings from New Zealand. So thanks Grant, and thank you very much for inviting me to speak on the panel. And it's a particularly timely topic for New Zealand, as we're now experiencing, as many of you know, we probably had a fairly good experience through the first part through the first wave of COVID, but are now experiencing a quite large increase in community transmission again with another wave back here. So starting to put in place some of the lessons perhaps that we learned from the first round, if you like. But my New Zealand's experience and
Sure, Mark, I'm not sure, you might have broken up. So let's see if Mark quickly comes back. But at least in my perspective, I think he's kind of frozen in time a little bit. So maybe while Mark reconnects, we'll just move on to our next panelist. And apologies to the audience. And so I think now we'll move, as I was mentioning earlier, maybe we'll just move to Tom's intervention. So Tom, over to you.
Thank you, Grant, and thanks for your very kind introduction. Unlike the other stories being told by my fellow panelists, the work we've done in South Africa to contribute to the evidence base for planning and monitoring and responding to the pandemic has succeeded in no small measure, despite, not because of, the actions of government. Just some brief context: almost 20 years ago, in the context of our presidential AIDS denialism, we'd built a system at the South African Medical Research Council to allow tracking of deaths on an annual basis using monthly extracts of updates to our national population register, and augmented and decremented by births and deaths on our CRVS. In mid to late January last year, the team behind that rapid mortality surveillance system were watching the emerging news reports about this new virus. And we asked the question, could we get the same extracts which we had been using to track the effects of HIV and AIDS on a weekly basis, and use that to build a system to track mortality in near to real time? From January to mid-March last year, we were able to negotiate a weekly extract from that population register, and then set about enhancing that mortality surveillance system to build a system to track excess deaths. We were able to have it tested, validated, and up and running just before the first deaths from COVID were reported in South Africa in late April last year. Over the last 19 months, our system has since been refined to the point where we have the only excess death monitoring system in Africa, and one of the very few in the developing world, one which is capable of indicating the potential burden of the disease in Africa. Our system is near to real time. It's a Wednesday today, so tonight we'll be releasing our weekly report on excess deaths in South Africa, covering the deaths which were reported to our Ministry of Home Affairs up until last Saturday, 4 days ago. My fellow panelist, Ms. Vena from Eurostat, talked about the importance of the basic building blocks in the developing world. Because what we were able to do was, because we had a national population register, because our CRVS is substantially complete, and because we have rich historical census and survey data, which allows us to understand and correct for the deficiencies in both. However, while the government reports approximately 90,000 deaths from COVID, the results of our excess death monitoring system suggest that perhaps 220 to 260,000 people have died from the disease in this country. It certainly gives the lie to the common trope about COVID in Africa, that there's a protective effect. Our data was also able to show that the government response to the outbreak, through, for example, social policies extending lockdown or curfews or restrictions on movement, were largely out of sync with the emerging burden of the disease on the healthcare system. We were also able to highlight, by means of a quasi-natural experiment, the exceedingly toxic relationship that our country collectively has with alcohol. We were able to show that a full ban on the sale of alcohol reduced unnatural deaths by between 30% and 50% a week, depending on the duration of the curfew imposed. But a further consequence was that we found that a partial ban on the sales of alcohol were ineffective in reducing unnatural deaths or in hospitalizations. And that finding went unheeded, and the country continued with partial bans long after the evidence had demonstrated otherwise. So in this sense, you can see the government response was often not informed by the science. On the upside, we've been able to work largely independent of government, and yet throughout, we have encountered obstruction, obfuscation, indifference, delay in getting access to data, in being allowed to publish estimates and analyses from the data we managed to get access to, in government's perhaps understandable unwillingness to accept the estimates of excess deaths in its responses to the epidemic. As concrete examples, we have never managed to gain access to the data on cause of death from the death notification forms. This because of a impasse between two separate ministries, our Health and Home Affairs ministries, and then also as a third leg to that problem, our National Statistical Agency. And all we get then in near real time is whether the death was due to natural or unnatural causes. And so in that sense, government has been nothing short of obstructive and often invoking the concept of official statistics to deny us those data. Even the national database of deaths, which contains information on the 90,000 reported deaths in the country, has never been harmonized across provinces, despite our efforts and despite us helping government to actually produce the data collection system, which would allow that information to be harmonized, which is why from the official levels, we don't get anything more than the sum total of number of deaths, because the data are in such different different forms across 9 provinces, that government can't actually work with those data in anything approximating real time. Finally, we've not been able to access information on vaccination held by our National Department of Health. We have not been able to show the true impact of vaccination rollout on any of infections, hospitalizations, deaths. And this has certainly been unhelpful in addressing fairly widespread vaccine hesitancy in the country. And so while researchers and academics in other countries producing near to real-time estimates of mortality arising from the pandemic are unlikely to have had to navigate those political minefields which we've had to navigate, all the while under-resourced in human, political, and financial terms. Thanks, Grant.
Thanks very much, Tom. As an interesting perspective and one that's quite contrary to what we've heard so far in the panel. I think maybe what I'll suggest is we kind of pivot back to this issue about how one can sort of connect more with the academic community, maybe and hear some other perspectives from other countries on what the challenges were from their side in order to sort of ensure there was a research dynamic in either informing new data products, if at all possible, or just sort of involving that expertise in this broader set of collaboration that we heard. So I think that might be sort of a useful counterpoint to what we've heard so far. But I'm just going to hold off because we have either 1 or 2 speakers left to go. I think I'm going to move now to Virginia for her intervention, and we're going to stick a little bit on the health front here for her intervention as well. And just as a little bit of an introduction, Virginia's sorry, I've lost my not my train of thought, my notes. But yeah, Virginia is the head of the Global Disaster Risk Reduction and a senior public health advisor for COVID-19 at the UK Health Security Agency. And I'm going to ask her to give us some of her perspectives, both from that disaster-related statistics from an international perspective, as well as the reflections from her role in her involvement with the UK. Over to you, Virginia.
Grant, thank you so much for inviting me to contribute to this session. It is a delight to hear my fellow panelists and your thinking about it. So I come very much from the health domain. I worked for Public Health England, which on the 1st of October became the UK Health Security Agency, as part of our look to the future about how we might manage future pandemics and other hazards. But all of this work that we have done inside the health domain has been driven by data. Data is absolutely key for everything we do. And Public Health England has been the focal point in the UK for reporting on the international health regulations to the World Health Organization daily on the numbers of cases, the numbers of deaths, but also the number of vaccinations. So data drives us every day, and there have been meetings every single day. They're slightly less now, but we start with our morning calls to find out what's changed the day before, often going down to individual regions or even local outbreaks to try and hear what the problems might be, as well as how we look at the cumulative data to be able to see how we move forward. Data has been absolutely vital for us for looking at outbreaks within schools, within prisons, within workplaces, and making sure that we can drive the guidance that might be needed for a lot of these different types of processes. Catherine, you brought forward a very interesting point about how important partnerships are. We know partnerships are simply critical to everything we do. So if I can give you an example, we worked very closely with our business communities through our minister at the time, to the major business communities and to our trade unions to find out what guidance they needed for working safely. And this even included how we should consider this to look at even personal care. So how would you manage people who wanted their hair cut? And a lot of people got very worried because their hair got a bit long, because we wouldn't let them go to personal care. And increasingly, one of the things that I've been involved with is providing the guidance with our Cabinet Office and our many partners for how we manage weddings. And we know that there's something like over 100,000 weddings that have been waiting since we lifted the guidance for people to be able to have weddings, because that was a crucial point for many people and they needed these social bonds. So the data has been driving everything we do at a local, small level to some of the bigger level decisions that have been made by our government. And one of the things the government has done is to, where there's been particular concern about the data, there have been press conferences called on a daily basis with our chief medical officer often there, or deputy chief medical officer with the prime minister, but also with our government chief scientific advisor sharing this data and trying to bring it to the fore. And obviously we link very closely with our Office of National Statistics to deliver this. But I also wanted to show you that although we try and communicate it at every level, we try and provide the guidance, we publish what guidance we're providing every day, the work behind it has been extensive. We also need to think about where we go to in the future, Grant. And I think this is something that I was really excited to see, that in the 49th session of the Statistical Commission, a decision was taken that a greater focus on disaster-related statistics, given the importance of the Sendai framework for disaster risk reduction, was absolutely key. And it has been agreed that it'll be an agenda topic for the disaster-related statistics at its 50th session next March. So statistics for disasters has suddenly changed in emphasis, not only in the UK, but also globally. And I think this is an incredible achievement. But one of the pieces of work that we've had to do is actually to try and agree what we mean by hazards, what we mean even by COVID-19. So earlier this week, on the 4th of October, we published the hazard information profiles of a globally agreed set of hazards, which cover 302 different hazards, from hydromet, extraterrestrial, geohazards, chemical, biological, environmental, technological, and even to include, for completeness, societal hazards. And amongst the societal hazards is the impact of financial shock. So these hazard information profiles, we will hope that statistical colleagues around the world will be able to take this forward and use them to try and make sure that we use common definitions, common standards to try and interpret this type of information, so that we can share our data better, we can understand what each other does, and we can look at those dashboards we all generate around the world, knowing that they mean the things that we really want them to mean. And we can also therefore plan for our national risk registers, our national risk assessments, but also improve, most importantly for people, our early warning, our information for what people might need to do so they can prepare for the next disaster more readily in a much more engaged and community-focused system. Thank you, Grant.
Thank you. And yeah, I mean, I think two things from that, which really complemented what we've heard from some of the other panelists so far. I think sometimes we forget, or at least sometimes I forget, that when we're thinking about trying to assess how one supports society and businesses through these pandemics, we sort of think in terms of perhaps dollars and cents and income support. But I think obviously what you were talking about from the UK perspective with weddings and haircuts, the sort of the capacity for people to sort of continue to have these bonds is also very important, and getting a sense of the connectivity between how data can kind of reinforce sort of the comfort and psyche of the nation is probably as important, or certainly a critical element, as well as the kind of the pure policy and intervention from an income or support or a social protection perspective. So that's very interesting. And thanks again. I think connecting with what Marianna said around the need for standards and profiles at the international level is definitely something that is well worth a stock taking, and using the this disaster related statistics framework is a great step towards that. I think Mark is back. So I'm going to ask Mark if he can now jump in a second time and see if we can finish the story from New Zealand. So back to you, Mark.
Thanks, Grant, and apologies, everybody. Yeah, we seem to have had a bit of an internet outage, so I'm now hotspotting off my phone. So, yeah, a fairly typical COVID problem, I think, that we've all experienced. So there we go, real life example. But yeah, I think I was saying our experiences were very similar to the other statistical agencies in terms of a need for more rapid data and using more wide and diverse data sources, engaging with customers and so forth. There was one in terms of the kind of one, so I won't dwell on that because others have covered it, but the one thing I was going to cover from a New Zealand perspective in terms of what worked well was our integrated and linked anonymized microdata. So New Zealand has a thing called the Integrated Data Infrastructure, or IDI, which we had stood up several years ago, and it really came to its own. It's largely a research tool which links together all of the data that government holds about individuals, anonymizes it, and puts it available for research in a linked way. So we link through the ID, what we call the IDI spine. We link births, tax records, and migration data, and then link other data sets into that spine. So you can get a really accurate picture of the New Zealand population and how it changes over time, and the life course of members of the New Zealand population. And having that, I think, really came to the fore. What it demonstrated was the value of that integrated data. Most of our policy making was based on a model developed out of Auckland University, where they undertook a research project very quickly to build a representative model of the New Zealand population, including schools, workplaces, family structures, etc., which we then used to model, or we helped the Auckland University use to model different contagion scenarios, and that was absolutely key to our government's decision making very early on in the pandemic. It's still being used today, and I think one of the other interesting things is the media became absolutely focused on the results of this modelling. And if we did this particular thing, you would get this many cases and this many deaths. If you did this other thing, you would get dramatically more or dramatically less. And so a real increase in prominence of the modellers. One of the most popular media celebrities here throughout our pandemic was actually Professor Sean Hendy from Auckland University, who ran that model and was always on a daily basis being asked to speak to the media about his modelling. So that was underpinned by that integrated data. So I think probably the one thing that hasn't been covered already certainly in where I was able to hear, certainly hasn't been covered, is that ability to be able to link at that microdata level and have that data available for researchers. Things to think about for the future in terms of lessons. I think I had sort of 3 or 4 I would cover. Firstly, developing an action plan to improve the findability and access to and sharing of that most important data. Like others, we were making it up as we went along, frankly. And so having that quick and transparent access, having talked to having that quick and transparent access available, having a sense of where the data is available, where researchers can find that data, and how can we meet those data needs really quickly. So planning, I think, for being able to find and use that data was really important. And to the points that Marianna and others made, having had discussions with New Zealanders already around social license to use that data. So that kind of preparedness about what's available and what can we use. Secondly, I think making sure that we publish what data there is and make it easy to find. So, I talked about the work we did with Auckland University, but we also got a lot of researchers that just, we never had contact with previously, who all of a sudden wanted data. And so we, like a number of other agencies, came up with a data portal where we put all the data around COVID-19 data available on the internet. But again, just the value of having all of that in one place. And so whilst we owned the portal and we stood it up, it wasn't just Stats New Zealand data, it was all the data that we could find from both the private and public sector that was related to economic, environmental and social aspects of COVID. And just again, the value of that. So we now carry that on as a standard product. So I think key learning for that is how can you, if you don't have that already put together, how can you stand something like that up very quickly? Third key lesson, I think, was around clarifying the responsibilities and scope and decision-making powers of data governance groups, and including proactively thinking about emergency powers that we might need for a crisis. So as you alluded to in my introduction, Grant, I play a role of Government Chief Data Steward, which is about getting government agencies in New Zealand who work with data to work better together. And we did. It was a bit chaotic in the first few days and first few weeks of the pandemic. So thinking about how can we use that leadership role to pull together both data governance and data quality, but also providing more direction for government as well, so that we didn't have 5 different government agencies asking for the same piece of information 5 different times. Those kind of really basic things. Another lesson would be around having those networks in place already. So Anil and others referred to the value of the networks, both with our customers, but also with our government, other government partners, and with research partners and so forth. And just having the value of having those networks already pre-established, and making sure you've got the strength of the networks you're likely to need, because we relied very heavily on those. And then finally, I think the pandemic itself perpetuated in some cases the disadvantage of certain groups in society, and in the New Zealand context, our Māori, our Indigenous population and Pacific Island migrants within New Zealand. They tend to be overrepresented in the negative social statistics anyway, and the data quality that we have about them doesn't tend to be great. And so that COVID exacerbated that, because they were disproportionately hit by COVID. So I think the lesson there is making sure that we've got, as best we can, visibility in the data of perhaps some of those groups that are less visible, and making sure that we actually do that through well-designed data collection methods and data standards. So look, that's all from me. Thank you very much for listening, and glad to have actually got through the presentation second time round. So thanks very much, Grant, and back to you.
Thanks. Glad the hotspot worked. It was great to hear your perspective. So thanks for scrambling. I guess it's kind of in the spirit of crisis management in pandemic, and getting new ways to work. I guess connecting through Zoom through new ways is equally important in these global forums. So thanks for that. I'm going to quickly turn to a couple of questions that have come in over this platform that the forum has. And I think I'm just going to throw them out, and then if anyone can just physically raise their hand who wants to respond, that will be the easiest way to do that. So I'm going to give you 2 questions at once, and we have about 8 minutes before we have to wrap up. So keep your response close, relatively short. One of the first questions is, how do we make sure innovations in official statistics introduced during the pandemic do not hinder the reputation of the National Statistical Office? Credibility of the NSO must remain very strong. So there's this question about, I guess, this trade-off between innovation, speed, agility, and quality. Where does the credibility of the office fit into that? So I think that's one question that I'm sure all of you are kind of reflecting on. And then a second question that's come in, which is, what feedback loops do you have to know that what your people are producing is what people need or want? So, there's a lot of different demands that I think were triggered from statistical offices during this pandemic. From leadership perspectives, how did you keep track of it all, and how did you make sure it was kind of fit for purpose? And what were the challenges of making sure that it was kind of coming out in the way you had hoped? So I'm just going to have those 2 questions. Hopefully I've done the questions that were posed justice. Does anyone want to kick us off? Does anyone have Mark does. So let's go back to Mark. Thanks.
Look, I'm happy to kick off on that last question, because I think that was where I personally, as government statistician, spend a lot of my time and got my leadership team spending a lot of time is actually going out, and I think Anil mentioned it right in the very early presentation, they're actually going out and just constantly talking to customers, because what we also found is that the need evolved over time. So firstly, it was about understanding, as we closed our borders, understanding some of the implications of that, for example, and then some of the implications on society as you started to have lengthy lockdowns, understanding perhaps the impact on individuals and their well-being, and then starting to think, as we reopened, starting to think about how different sectors of the economy were rebuilding. And in the New Zealand case, we rely heavily on international tourism. The borders are closed, there's no air travel. What was the switch to domestic tourism looking like, and how did that change the tourism sector, and working with the tourism sector in partnership on answering some of those questions. So it was really just that constant being out there. There's no substitute, to be honest, with that constant being out there with senior people talking to other senior people in the sectors and in our customers about what they were needing and how those needs were changing.
Thanks, Tom, Mark, and I'll pass it to Anil.
Yeah, just to build on Mark's point and the excellent questions. First of all, if you don't have a solid foundation and you try to build, the second level, what's going to happen, right? So I cannot overemphasize the importance of ensuring that those that infrastructure, that expertise, that basic statistical sort of infrastructure is in fact solid. In our case, that's how we could move forward. And really for us, it was a pivot from going from a data provider to different roles. It was about going from here's the data to really storyteller and sense maker. So I had to put a lot more emphasis on analytics. We had to be more of an integrator, and I think Virginia and others have spoken to the importance of standards and definitions that are absolutely crucial. It's about having the kind of data flows and access with the kind of trust that's absolutely inherent. So transparency and trust are critical, and it's about being a facilitator where we're now bringing policymakers, researchers, the media, academics, etc. together. And it's not just one version versus another, because we don't want to fragment what we put out there. We want to actually integrate, because what this crisis has shown is that societal, environmental, health, and economic factors are actually very, very interlinked. So so that's what builds the credibility of the NSO, is to build on that strong infrastructure and to actually use that to kind of propel, the value proposition even forward. On the feedback loops, very quickly, you have to look at it from both a short and a longer term kind of view. I think statistical organizations provide that foundational framework of data, insights, et cetera, that are going to be used and studied for a long, long time. So you can't forget the kind of frames that we have built, whether it's registers or our systems of national accounts, and so those are going to be really, really important for future decisions while we're trying to address immediate needs with good enough, decent data, I would say. So I think it's both. We cannot just forget about the longer term impact that we make on a better understanding of society.
Great. Thanks for that. Thanks for both of those responses. So I'm going to have to cut off the responses there because we're in the last 2 minutes of this session. So before, in case like the curtain closes abruptly, because I'm not sure how this is going to work, I'd like to thank everybody for their participation today. It's been a really enriched and interesting discussion. So thanks again for joining. I think in terms of takeaways, I mean, there's a lot, and I think we'll probably sift through the recording of this to sort of reflect on how we can support other countries from learning from some of the lessons we've heard in today's, both pro and con, in terms of how governments and statistical agencies responded. I guess maybe in terms of like the dimensions of thinking about this in the future, obviously there's sort of three that come to mind. One is the nuts and bolts stuff that we hear about often, and I guess it's been the dominant feature of a lot of discussions in the past on things like the technical platform, the data access, the standards, the technical human resources to sort of transfer this information from raw data into insight. All of that foundational stuff you don't want to be building during a pandemic. You want to be building it anticipating all possible future crises. So I think that whole straight is a critical one. The second thing I think that we heard was like this notion of leadership and culture of the organization is very important. So we've heard terms like proactivity, partnership, outreach, network adoption, communication, feedback loops. A lot of that is really still kind of, I would say, a place for for growth and perhaps a little bit of cultural shift in many statistical offices. So it's great to hear so many positive stories about that. And then the last one, and I guess I'll sum up where we started, which is on governance. I think we did hear the importance of having clear rules, regulations, the right kind of enabling environment for governance to work well is another thing that you want to start putting in place before you're sort of responding to a crisis. So I think as we think about these issues and as if we start to sort of document these lessons, there is a kind of a natural set of dimensions by which I think these sorts of lessons could be adopted. So now we're at 8:45, so I think we're over time. Again, thank you to the audience for joining. And if you're virtually connected, give people a virtual clap. And if you're there in the studio audience, clap away. And I'm going to thank everyone again for their support. Thank you.